It is completely normal to feel a bit anxious after surgery, especially when you start to notice some changes or discharge from your surgical site. Many people wonder, what exactly does normal healing look like, and when should I be concerned about bleeding? After surgery, some degree of bleeding is definitely expected, but excessive bleeding, bright red gushing blood, or large amounts of blood soaking through dressings is too much and requires immediate medical attention. Your surgical team will provide specific instructions based on your procedure, and it is always best to follow their guidance carefully. The body undergoes significant changes during and after a surgical procedure. When tissues are cut, tiny blood vessels are inevitably disrupted, leading to some expected oozing as part of the natural healing process. This often appears as a pinkish or reddish fluid, known as serosanguineous fluid, which is a mix of blood and serous fluid. It is usually thin and light. However, if this fluid becomes consistently dark red, thick, or increases dramatically in volume, it could indicate more active bleeding beneath the skin or within the wound. Factors such as the type of surgery, your individual clotting ability, and any medications you might be taking, like blood thinners, can also influence the amount and type of bleeding you experience. If you observe an increase in bleeding, the first step is often to apply direct, from pressure to the area with a clean cloth or sterile dressing for 15 to 20 minutes without peeking. Elevating the affected body part, if possible, can also help reduce blood flow to the area. After this time, if the bleeding has significantly slowed or stopped, you should continue to monitor it closely. However, if the bleeding persists, becomes heavier, or changes to a bright red color that soaks through your dressings rapidly, it is crucial to contact your surgeon or their office right away. They can assess the situation and provide professional guidance. One insider tip is understanding the difference between a hematoma and active bleeding. A hematoma is a collection of blood that pools under the skin, often causing swelling, bruising, and tenderness. While some small hematomas can resolve on their own, larger or rapidly expanding ones might require intervention. Active bleeding, on the other hand, means blood is still actively flowing from a vessel. Sometimes, surgical drains are placed during surgery specifically to help remove excess fluid and blood, preventing large accumulations and offering a clear indication of the amount of drainage. A sudden increase or decrease in drain output can also be a significant clue to communicate to your medical team. Ultimately, recognizing the signs of normal healing versus potential complications empowers you to take appropriate action, ensuring your recovery stays on track. Always remember that your surgical team is there to support you through this process, and communicating any concerns, no matter how small they seem, is key to a smooth and successful recovery journey.